Santino just looks like he feels terrible, and he's not hanging out with Zuletta, and he's got that pinched look, and flies all around him, which is never a good thing. Santino Serval has been acting like he doesn't feel well, so Jamie and Gail are going in to net him. Morgan, get ready with the door. See, that's nice and soft.
Just put it down a little bit more. All right, hang on a sec. Can we, yeah, give us a bit. Fly larvae on this today.
Nice work. Apparently, lightning took out our generator, so we weren't able to use our own hospital, so we had to drive Santino to Dr. Wynn's clinic.
We're going to Dr. Wynn's clinic. We're going to Dr. Wynn's clinic, so there's obviously other doctors and other cases happening right now. So we'll be in areas that are kind of tight with other people walking around, so just be aware of your surroundings and
Like
make
constantly
sure,
watching
make sure
behind
you're not
you.
in somebody's way. 'Cause sometimes the doctors will tell you get out of the way, but sometimes the techs won't, and you don't want to hinder what they're trying to do. Santino was sedated and examined about 3 years ago in 2013, and then he had some cysts in the liver that we took samples of that came back as not cancerous, but maybe could be cancerous. So
I love his laboratories. They're always so definitive.
they're very open-ended, so we're going to take him in and x-ray him and see if it is cancer. It may have spread to the lungs, which we would see in an x-ray. If we don't see that, we'll probably take some more samples of his liver using ultrasound and have it tested to see if now it is showing up as being cancerous.
Yeah.
5 New York Servals, 4 of them are thought to be related because they all came from the same pet shop in New York. And they all seem to have liver issues and have been on supplements for their liver since their arrival. Yes.
Sorry about the sound. All I can tell you is please turn it up to 100% volume.
To Cinco de Mayo. Inject this.
Make sure you don't catch his feet or tail or anything when you're pulling him up.
And a little higher. There we go. Then we can bring him back down and we cover him up and then we let him go to sleep. His foot's sticking through. You're dropping if you're not ready. Okay. Man, you have no scruff, buddy.
Because he's so fat.
Oh, yeah. Oh, he's heavier than he looks. It looks like it'd be easy to pick up. Doesn't look like a tooth.
change in his eyes. We put loop in their eyes because they don't blink when they're sleeping, so otherwise their eyes get dry and they could get an injury on their eyes. We can give them drugs in the muscle, which takes a while to absorb. We can give them drugs in the vein, which sure. If one of you wants to come over here, I'll have you be my human tourniquet. And if you stand on it, but he's not as sleepy as I would like, so we're gonna avoid the biting in low his blood pressure is. Those are better breathies. Are you sleepier now? I think you are.
Do you want a
Hold that
burrito
sheet up. Yeah.
Fold it into a sling, so
It's like into a square you can fit on.
The left wrist is crunchy. Has crepitus. Right, window. I know, I'm sorry. I stimulate you a little bit now that you're sleepier. Right here is abnormal.
I think
feeling.
just that corner has to come up towards you.
Hi, deep breathy. Alright, I'll lay it there. Yeah. I'll do that. I'll bring drugs. So your liver is down here and shouldn't have these weird bubbles in it and should be smooth, not bubble, bubble, bubble is liver, and that's what we're feeling, but shouldn't be irregular. Usually the liver looks like a triangle right there. How it looks like that, a little pointed edge. So the liver's enlarged and irregular in shape there, causing the stomach to push up this way. Kidneys are there and they look smooth, so that's good. This is air in the GI tract, that's poop in the GI tract. There's a little spondylosis there, a little bit there, and there too. Chest cavity looks okay. And then this is abnormal, should be liver. This is odd, this texture, it shouldn't have those bubbles in it.
We're going to the other room?
Yeah, go one room past Carol.
oh, past me. It's the number one reason that I'm happy we have our own hospital, because I can't stand the sound of dogs. And I'm sure the cats can't either.
Do they have an easier time?
Yeah,
That way?
That's fine.
We stopped it and changed him to metronidazole and he got better last time. So I guess the question of the hour is, can we find an answer with the needle, or do we just need to explore? We're looking for the answer of faulted on both readings.
What's that mean, faulted?
It says it can't read on our machine because his blood is breaking apart, it's hemolyzed, but his white count's low, so he's trying to fight something. Okay, new answer. His total bilirubin is high, and that implies that his bile isn't flowing as well as it should through his liver, which we know because his liver tissue is abnormal. His BUN and his creatinine are high. His creatinine is pretty high. So I think let's give him fluids and get the samples back, and then send blood to the lab to see if it can read the ALT. That's going to give us more information.
Just don't pull. Squeeze more right there. A flea comb might be better.
Yeah, this is.
Here, are you
That was
coming
the
over?
only
Are you
thing we
good
had.
watching him for a second? I'll grab you.
Oh no!
You see? You saw this? all on his tail?
What's wanna come one? You can take turns.
You can arm wrestle for who doesn't have to comb
do you
your
wanna-
hair.
Yeah, I'm gonna.
So we're
That
not
was really
spilling
cool. I'm gonna
lots
step
of
back
side
for this
right
one.
You
wants to come fleas out of Santino's butt.
Oh, not even fleas. This is even grosser. This
Are
is
they
infinitely
vets?
grosser.
Yeah. Yeah, he's got mostly up here and on his tail.
So what kind of eggs are these exactly?
You should just go look it up and Google image.
Well, I know
Just
what
go straight to
botflies
images.
are, but
Yeah.
I didn't know that they were here.
Yeah, no, and then the fun thing is once they hatch, I don't know if they do this with cats, but they will burrow in the skin.
And I thought
I've seen
that
that with
was where the
domestic
eggs
cats.
are.
Yeah. So then you get cutie rot and it's or just,
Did
you
you
know,
find any wounds?
no. They may have just been
They're
his
kind
bloody
of just
urine.
all over. They're like
That's a
on
good
his
point.
leg, they're on
His
his
urine was
tail,
bloody, so.
on his feet. He's
Are you-
kind
you're
of
not
like,
grooming.
he's kind of gross.
You're not grooming.
Um,
There's like up here and on the tail on
Few
this.
hunting times. Okay. Yes. And then
No, you're good.
Jen
Yes.
or Jamie, hit the button freeze and then P1. Far right, biggest button, freeze.
My hand's definitely.
Yeah. Ooh. That's it.
Hey.
Hey, we want to put an ultrasound probe on his
Dr.
bladder. I'm gonna stop expressing.
Yeah.
Yeah.
Very
that
bloody.
makes me think that he might have a TCC as well.
Maybe
Let
more
the
gloves.
eggs go away first.
And then yeah, just spray it. And this, can we just? I'm just gonna.
Throw that away.
Well, do you want to send it or do you want to do it here? Because I have.
Yeah, I think
About a
we
tiny,
need
tiny
to
amount.
do only.
I mean, I could maybe.
to do it here.
Okay. His heart rate's coming back up. So I don't know if we're walking back down again or not. Like, are we? Okay.
So here.
I wasn't sure how much longer.
Needing to gross things off, and did we pick through his skin to make sure we didn't find?
You want to play with some botfly eggs?
Did we not get to the other side yet?
Oh my goodness. That's a lot.
He's got a bunch.
Hairless,
No, but that makes sense as to why all of the flies
my
are
theory.
sniffing around back here
He's got blood
because
back there.
he's got blood dripping out of
He's laying
his,
around a lot.
and
Not
he's
very-
laying. That's what color it is.
That's
So
good.
Wow.
before we explore him or do anything crazy with his liver, we should
Dr. Johnson.
deal with the urinary tract issue.
Hand
This way. No, the one I handed her. That's why I handed her. I'm like, you take this one and label this one now, so we don't have
Try to get all that crud out from under his fur into the trash can so that you don't just keep rolling him in it.
Okay, and where did my little friend go? The little. Be able to look at urine. We've got that. We've got all the blood. We can send that to the lab. We can send the slides of his liver to the lab. And then we have a urine culture that'll take a couple days. In the meanwhile, we'll put him on antibiotics. And oh, well, we don't really have to because we gave him convenient. But it would probably be good for him to get sub-Q fluids each day.
It'd probably be easy. It's like he was.
Yeah. Bilirubin could be elevated if he is hemolyzing his blood, if he's breaking his own red blood cells, then he could have blood in his urine from that and a high total bilirubin. The drugs that we use a combination of different drugs. Some of them can be reversed and some of them can't. Yeah, so some of the drugs will have to wear off, and the gas, we try to give them as little gas. Oh, hi, this is me.
Oh, look,
gas
he's moving
as
his head.
possible, and then give them a little bit of oxygen, because the gas will wear off as soon as the gas is displaced by oxygen. It lasts 2 weeks. So if we needed to, we wouldn't have to give him anything by mouth for the first couple days, just to get him back on food. So wait. Okay. Okay. I get the bitey end only because I'm closer. Okay. Hey, can you pull that open? Or we can. Knew his liver had cysts back in 13. So now it's 3 years, 3.5 years later, and if he had an aggressive cancer, probably still wouldn't be here. Yeah. So we're hoping that it's still just a cyst. Then when we find, okay, there's bloody urine coming out of his profuse, that's where the flies are. That seems like a problem that's more eminent right now. And knowing that his kidney values are elevated, so that urogenital system is having problems right now anyway. So he could have elevations there because he's dehydrated, but also because he has kidney disease. So if we can rehydrate him and correct the infection in his urinary tract, then we can see if that's really what's making him feel poorly. And based on the urine that we saw, we're smarter to evaluate that first because he's not a good anesthetic risk right now anyway. So if we can at least make that part better and then we find that he's still acting strangely, then we could do surgery.
I had Simba the other day, and he was so much heavier.
He is.
Oh yeah, he's so much bigger.
So, red blood cells, but it looks more like muscle. Because if it's just normal urine, then it should spin down to yellow, and it's still that color.
Yeah.
Yeah.
Thank you very much.
You're welcome. I wish. Why couldn't he have a uterus and that be all messed up? Just cut that out and take that out. Just take that out and be done with it.
Oh.
You changed yours.
Yeah. My old one got cracked.
Oh,
It's actually Bengali coffee maker.
that's awesome.
I had just finalized this video talking about what we would be doing for the next few days for Santino, but apparently he was sicker than we even realized and passed away shortly afterwards. He never woke up from the anesthesia from the diagnostics today. I know Zuletta will be very sad without him.